there's been a lot of talk about consumer-directed healthcare. Some of it not favorable, and everybody says, oh, it's a big failure. Just listen to what they're saying. They're saying it's a failure for consumers to be in charge of healthcare decisions. Who do you think might be thinking that? It's people who think the government ought to be in charge of healthcare decisions. So consumer-directed healthcare means that you're going to have more authority to make those decisions for yourself. If you and your family want a particular kind of health insurance policy, let's say you decide, I'd rather save money on the premiums and have a higher deductible policy, like most of us do with our car insurance. Or, you know, I've got 3 little children, I really want to go to the local HMO because I know the doctors, they know me, it's easy to get appointments. Let people make those decisions, not politicians. And allow that insurance to be portable so that people can make decisions, and then you will see the market respond to us as consumers. We have one little glimmer of evidence of that can even work in public programs. A lot of criticism of the Medicare prescription drug benefit, but the way that they did it is really a way to show us that this can work. Instead of having the government say, here's the list of drugs you can have, and we're going to tell people how much they can be paid for those drugs. They said, no, we're going to allow people to choose among different plans, and they can decide, you know, does this plan provide the routine, the maintenance drugs I need? All the plans have to provide access to 2 drugs in every category, so they knew they got good comprehensive coverage. They drove the price of that program down. The Medicare Part D program is coming in $200 billion under budget. When have you ever heard of that before in a government program? It's because private competition works. People were out there trying to find the policy and the plan with the lowest premium, and the companies were competing to offer the lowest premium in concert with good quality. So when the government passed the legislation, it said this policy is going to cost $37 a month for seniors. Some members wanted to just lock that and say, no, it can't be more than that, $37. They said, no, let's see what the market does. First year that the average policy was $22 a month for seniors. Because competition works. That's what we need more of in our health sector, to give people more choices and more opportunities, and give the market the chance to provide those options and responsibilities so that we can then have the responsibility to make the right choices for ourselves and for our families. Thank you very much, and let's take some questions.